Like cancer, diabetes, heart disease, people having heart attacks and strokes, all these health problems, with a lot of research and study over many, many years, and people that have had a lot of experience will tell you that our diet has everything to do with our health. Yet, anytime I go into a grocery store, it seems like 98, 99% of what they sell has got preservatives, additives, flavor enhancers, high fructose corn syrup, sugar, all kinds of things that all have been linked to cancer and diabetes. I've seen more people in my life die from diet-related illnesses rather than alcohol or tobacco or drugs. The majority of the people in my family and my friends that have died over the years, the root cause is diet, and it's not their fault. That's the thing that pisses me off, is it's not their fault. I just learned about this over the last 2 to 3 years. When I quit smoking, I decided to get involved in being healthy all the way around, and come to realize that almost everything you buy at the store has got stuff in it that will cause cancer, diabetes, and over the last 6 months, I've had a few close friends die. Over the last couple of years, many. Well, people become diabetic because they're eating a bad diet. If you have cancer, stop eating unhealthy foods and you have a better shot. If we're all human, I'm talking to everybody else who's human here like I am, we all have a tendency to have things that are a vice. Things that make us, give us a little pleasure or a little bit of feeling of satisfaction. People will shun those who drink alcohol or smoke, but they don't say anything wrong about a bad diet, like eating too much sugar. Is everything that's bad for you, they make it taste more than good. They add stuff to it, flavor enhancers, to make it taste good. And there's things that actually make it, a lot of junk food is addictive. I have known for years, and I have said that sugar is probably one of the most addictive drugs in the world, if not the most addictive. Now, people say you're calling it a drug. Well, I call it a drug. I mean, if people are drawn back to it because of how it makes them feel, or because it tastes so good, it is actually triggering parts of their brain that make them want it more, and again and again. Okay? That's the same thing that cocaine does. It's the same thing that heroin does. Same thing that methamphetamines do. They make the person want to come back because it makes them feel good. I'm just saying that I need to do a lot more research, but I need to say to everybody, I just had to say this right now, that probably the worst thing the worst thing nowadays that kills people is food. Now, and it's not food. It's what the stores sell and they call food. Every time I go into a store, like I said, 99% of what's in there is junk. It's all junk. If it has any additives, preservatives, flavor enhancers, anything for preserving shelf life, it is bad for you. Probably about 5 days ago, I was bad, and I got a lot of sugar. I had a craving, and got quite a bit of sugar, and I ate on it for a couple of days, and let me tell you something. I feel it. There's quite a few different side effects that I notice from sugar because they've been gone for a long time, and then when I go to eat sugar again, all these symptoms come back that I had previously when I used to eat sugar all the time. I just wish that I could get it to sink in to so many people that you don't realize it and it's not your fault, but your diet and the foods that they are selling as healthy, foods that they are selling you at cheap costs, are not good for you. There's so many things that are bad for you that nobody will tell you is bad for you, and you won't realize it till you've already done damage and you're close to death. So many people have died because they really don't care. They really do not care. You're just like when a man walks into a strip club, all the strippers see is a dollar sign. So all you are as a consumer is a dollar sign. They truly do not care about you. People are getting paid off by lobbyists. A lot of things will get passed and say that it's okay for you because it's got such a small amount of whatever thing whatever of the things it has in it, such a small amount that one dosage will not harm you. But what they're not considering is people who eat that thing every single day for weeks, for months, for years. What happens then is there's a residual buildup. Residual meaning that it accumulates over time. Our body was created to digest food. It wasn't created to digest chemicals and preservatives, additives, flavor enhancers, things that aren't natural, things that are created in a lab. Our body was not made to digest. So, it accumulates in our body. And what do you think happens when things that are bad for us, that they say one dosage, oh, it's not going to harm you, such a small amount, when that accumulates over a period of weeks, months, years, decades, what do you think that causes? What do you think when our body can't digest it, what do you think that does? And that's just one of many factors, but that's just one of the ways that I like to explain it, is that imagine you're eating something for 20 years and it's got some bad stuff in it that just builds up and builds up and builds up, and it gets to a very toxic level that ends up causing cancer, or someone have a stroke or a heart attack. I don't know. I'm not an expert on these things, but I've studied enough to know so much is not good for you. So much not good for me and you. And most people don't even know it. I just want people to think, to stop and think, and to try to educate yourself. I'm working on educating myself, but I can sit there and look at somebody and tell them this. And so many people, it just doesn't make sense to them because that's not what they were taught. And it truly is sad when people, when you can avoid all these health problems by just watching what you eat, but you choose not to listen because it tastes good. I'm so sick of hearing that. But it tastes good. I like it. Well, is everything that tastes good or feels good, is it good for you? I don't think so. That's all I got to say for now.